Hi, I'm Dr. Naresh Govindarajan. I am a vascular surgeon from Sunway Medical Center. Today we're going to talk about arteriovenous fistulas. Now, arteriovenous fistulas are the lifeline of a hemodialysis patient. As you know, when a patient develops chronic kidney disease and eventually develop renal failure, they will need dialysis. There are two methods of dialysis, mainly peritoneal dialysis and hemodialysis. Now, hemodialysis is a method of doing dialysis to remove both toxins and also excess water via the blood. There are various ways of doing it, and the best way to do it would be an arteriovenous fistula. An arteriovenous fistula is basically a connection between the vein and an artery. So for a dialysis patient, that's constructed via a surgical method. So we'll make an incision, do a small operation, and we'll connect the vein to the artery. What's hemodialysis? Basically, two needles are inserted, one into one part of the vein, which draws blood out of the patient. It goes into a machine, which is the hemodialysis machine. Now what the machine does is that it removes excess water, removes the toxins. Then once the blood is clean, the blood is then returned back to the patient to the other needle. And this process is continued every time a patient goes for dialysis, and it will last for 4 hours each session. This is a diagram of an arteriovenous fistula. As you can see, this is the right hand. This is the artery. The artery is what's in red. The vein is what is in blue. Now, when you create an arteriovenous fistula, the vein is connected to the artery. And what happens is that blood is then short-circuited into the vein. You must remember that patients who are on hemodialysis, there's no cure except for kidney transplant. Now, while the number of kidney transplant in this country are increasing, yet the number of patients requiring renal failure is a lot more. And as such, the number of patients requiring dialysis will get higher and higher in time. Most patients don't get transplant, and as such, patients will require a fistula for the rest of their life. So that's the reason why we emphasize the importance of the care of a fistula. After this, the next video will be on how to take proper care of a fistula. Thank you very much for watching this video. And if you do have any questions, you can always go to the website of the Vascular Society of Malaysia or any other website, or contact any vascular surgeon that you know of.